started working for Dr. Smith in April of 2005 after he did my lap band about 6 months prior to that. I came on board as the first RN in the office, came to work for him because I have a lot of respect for him as a surgeon, as a bariatric surgeon, and as a person in general.
I grew up in southern Oklahoma. I graduated from Ardmore High School. I attended the University of Oklahoma undergraduate, and it's kind of interesting. I was a geology major at the University of Oklahoma. My neighbor across the street was an osteopathic physician. His name was James Turrentine, and he wrote me a recommendation to go to osteopathic medical school, and I applied and I got in, and it was the best decision I ever made.
What you see of Dr. Smith is what he is. He is true to his word. He's very ethical. He does what he says he's going to do, and he doesn't just change his mind without thoughtfully thinking through and hearing all the facts on things. That's how he became a lap band surgeon. He did the research, he did the workups, and he found that this was the best tool.
In 2001, or late 2000, I got interested in the lap band. And I got interested in that because I was severely overweight. I weighed up to 285 pounds at my highest. My grandfather was over 300. My whole family were overweight, diabetic, hypertensive. As we know, the list goes on and on, all of those ailments that went with my weight. And I was already struggling with my sugars. I had sleep apnea. I had severe reflux. I had plantar fasciitis. I had already herniated a disc in my back. I hurt from the top of my head to the bottom of my feet, and I was sick of it. And I learned about the lap band, and I was really interested.
I remember, I was his trainee at the time, and I remember him going through a number of different diets, and I seen him have some success and some that were not successful. And I think he just got tired of it, and he saw the promise of this lap band when he first got trained on how to do it, and he decided it was for himself.
There was no one more afraid of surgery than me. But I bit the bullet, and in 2002 I had my band. And I've lost right at about 100 pounds. I've kept it off for at least 2 years now. I have absolutely taken no medications. I feel better than I have in my whole life. And I've dedicated the rest of my career and my practice to taking care of band patients.